afternoon. I'm Dr. Murali Bharadwaz. I'm MD in General Medicine and a practicing physician from Hyderabad. Once upon a time, during the grandpa days, there used to be 4 sons. One is from IIT Madras and other is from IIT Bombay. And the third is from the Stanley Medical College and fourth is 10th class failed. So when we used to ask grandpa, how do you feel about your sons? He used to say, I'm very happy with my last son. Why? Because when he has stroke, his IIT Chennai son will be busy in a boardroom meeting. And his another well-settled son will not have time to come and help in getting a Foley catheter removed. So India has got aging population of about 100 million, which is 10 crore aging population above 60. So now with the nuclear families, we have either 1 child or 1.5 child. And that too, they are settled in America or any other big city. And they can at most buy some flowers and bring to the old man at the last moment. So what we have contemplated is, how can we take care of this solution of home health care? There are some giants like Portia, about 100 plus crore funded, Nightingale-like companies, and Call Health, etc. They are hugely funded and they are like Meru cab model, where they have got a set of drivers with them and they send their people whenever demand is there. But Uber has totally changed the model. Uber has created entrepreneurship among drivers. So can the similar situation can happen in doctors, nurses and physiotherapists? Earlier days, if you finish MBBS, somebody used to give a girl, easy to marry, open up a clinic and start practice. But today, after the corporate hospitals came, there are no family clinics available. So most of the people either work as a duty doctors in the nursing homes for a small fee of about 15,000-20,000 rupees of salary. And they keep preparing for MD entrance exam. And we had been giving coaching to 150,000 doctors in the last 15 years for their MD entrance preparation. So we know the problem. So what we thought is, let us come up with a Uber for home health care. So we have developed an app, which is just like you can call for a SUV or a minivan, etc. You can call either a doctor, nurse, or a physiotherapist, and whoever is nearby your home, whom we have aggregated and available on the app, can be able to reach. And simple things like a physiotherapy or a post-operative care or putting an IV line or checking the blood pressure. These are the things that a MBBS doctor without MD can be able to do. So we started a company in US. My co-founder is an interventional cardiologist, Sujit Reddy, and Mr. Vivek Reddy is our COO. He is also a serial entrepreneur and runs a incubation center in Hyderabad called Sparkton. And so we developed an app. We have a 23 technology team in iOS and Android who have developed an app. We have aggregated about 4,000 doctors, 2,000 nurses. Wonderful. Then we went to patients. There is a small pitfall in this hypothesis that we had as a blinded entrepreneur. As rightly said, entrepreneurs are emotional. We think our idea is the best in the world. So you need a driver in Uber almost every alternative day. Today, we don't want to even buy taxis. We can happily, we don't want to buy car. We want to happily go by Uber. There, the requirement is every alternate day. Whereas in the case of the health, 80% of times we are healthy. Why do we need an app for that? So that's what the patient said. Unless there is a healthcare app which is constantly engaging the patients, then only they will retain an app, and whenever they are sick, they can be able to order one of the healthcare service. So how can we engage the patients? Which app you don't like to remove from your phone? WhatsApp. We don't want to remove. Even if phone is burnt also, we will run for the next time. First thing we do is WhatsApp installation. Similarly, we have got apps like Tinder or Facebook or LinkedIn. We don't want to remove. Why? Because there is a social networking. So if we can create a social networking element into the app, then patients in their healthy time will start interacting with others. And whenever they are sick, they can consume all these value-added services, which are aggregated, like doctors, nurses, home delivery of the drugs from the hyper-local pharmacies, etc., etc. But what can be a social networking feature in case of health? Very simple. If somebody is pregnant, they will give a call to their aunt and say, hey, aunt, Mausi, mujhe feet mein swelling hai. She will say, don't worry, beta, little will be there. While you are born also, it was there for your mom, that's fine. But suppose, if somebody is diagnosed with HIV, somebody is diagnosed with lung cancer, can we pick up and call people and say, hey, who in our uncles and aunts are having HIV or lung cancer? We cannot say. So we want to anonymously identify, without our identity being revealed, who are the other people who are available in the social network who have a similar clinical problem, and try to associate with them by instant messaging, etc. Become a part of the clinical group on the mobile app and start interacting, and that will bring a collective clinical intelligence which will bring the survival value. So we have introduced Facebook, LinkedIn, Tinder-like features where social networking, instant messaging, video consultations, etc., can happen so that we retain the patients. That is the demand side. At the same time, we went to doctors, nurses, physiotherapists, hospitals, pharmacies, diagnostic centers, etc., and we have onboarded them into the app. But now, one important challenge is, when you go to any hospital or a pharmacy, you ask him, please onboard into the app. He will say, are you like Just Dial? Will you bring me new patients? If you promise me that you will bring me new patients, then I love to be on the app. So we have shown that there is a huge social network element which is available with a lot of people downloading to engage with each other for the health reasons. So that is the reason you come on to the app. So that made about 150 pharmacies and 300 doctors to become our paid subscribers. So the solution that we offer is, we are the connector on a social network platform between the demand side of the engaged patients who are mutually engaging for the health. At the same time, the aggregator and marketplace of around 13 services, which include the doctors, nurses, physiotherapists, pharmacies, diagnostics, hospitals, beauticians, and healthcare fitness specialists. Now, so we incorporated the company in US in Feb 2016. We are able to convince, at least confuse 10 of the doctors who are practicing in US. 4 of them are rheumatologists, a couple of them are endocrinologists, etc., to put each around 20,000 USD and 30,000 USD and raised 300,000 USD. Then we have developed a technology team and completely developed the app. And earlier days I used to say, hey, app is only an enabler. It is not, technology is only enabler. But later on in a hard way I learned, technology is all about, first technology should be good enough. Then it become a perfect enabler for enabling the desired dream of an entrepreneur. So now we know how to develop an iOS, Android, on whatever you call in the social networking area. So then we developed a technology platform, and we incorporated a 100% subsidiary, that is a Click2Clinic Healthcare India Private Limited in India. And we aggregated 1,800 doctors, diagnostic centers, etc. And 1 month back, we ultimately launched the final product, Clinicopedia. And in 1 month, we have 11,000 downloads of the app, and people are very happy that next door pharmacy, they are able to identify, connect with him, and get the drug delivery to home. Then there are 2 revenue models in our entire proposition. Number 1, from the providers, for onboarding them onto the app, we charge an annual subscription fee. But what do we give them? We will list them, provide their images, videos, patient video testimonials, everything to bring credibility to the patients. And we enable the patients to take a video consultation, chat consultation, or a home appointment from the provider. So that is what we do. And we basically charge about 5,000 to 10,000. Then we don't charge anything to the patients. Every time patient is taking a transaction with the healthcare provider, we charge about a small amount of 50 rupees once more from the provider, whenever reconciling to with the provider. So that is all about the Clinicopedia, the platform. And in US parent company, we raised 1 million USD last week from 2 institutional investors. But still, why we are raising fund in India? we want to go with this to 120 countries. In every country, we want to identify the local investors who like to invest for the local market, and that is the reason we are looking forward for raising around 1 million USD in for the Indian market in order to take it forward to the people. Then these are all great ideas, but ultimately when we need to take it forward into the people, unless we think disruptively, we cannot. So what is the disruptive way we want to get the downloads of the apps and onboard the providers across India onto the app? So we have a Healthcare Skill Sector Council of India. So they have created around 14,000 centers, and those centers are acting as our distribution network in order to get the downloads in all the small tier 1 and tier 2 cities also. That's how disruptively we want to get the downloads done, and at the same time onboard about 2 million providers, including all 13 categories onto the app. So thank you so much. The point is, if we look into this digital healthcare segment, we were euphoric initially that the great need is to talk to doctor. But later on when we gone to the market, we understood greater need is for not even nurses, caretakers who are not even qualified nurses. That's the reason the marketplace helps them to identify who is the best caretaker or a nurse or a physiotherapist available in the nearby area. Now coming to your question, it's a question of demand and supply. The number of patient downloads you are able to achieve. Suppose if you are able to achieve 1 million patient downloads, then 1% of them start taking consultations with the doctors, then your 1800 doctors will get X number of opportunity for consultations. So that is the reason it is very difficult to say now. Just we launched about 1 month back and we have 11,000 users, and 30% of them only will be active users. Out of them, what percentage of people are taking consultations is too small a number statistically. The moment we scale up this as a Facebook and Tinder and a LinkedIn for healthcare among the patients across India, when the demand side increases, then automatically all the suppliers will get their own share of opportunity to deliver the consultation services. So that is how the model works.